The kinterra foot-ankle system combines hydraulics and carbon fiber to provide low to moderate impact K3 ambulators an exceptionally normal walking gait, regardless of surface angle or speed. The result is rock-solid stability and the confidence for users to choose their own path. Articulated ankle movement provides 12 degrees of motion, with adaptation to slopes for improved stability and overall comfort. An innovative dorsal assist spring assists toe clearance to prevent stumbles and falls. Precision controls are easily accessible, making the setup fast and efficient. The design uniquely delivers gait simulating biological norms on both slopes and level ground for superior stability. The kinterra is intended for use by low to moderate impact transtibial and transfemoral K3 level ambulators. It is recommended for unilateral use. Caution should be used when fitting bilateral patients due to the added movement of the ankle. Kinterra has a weight limit of 275 pounds or 125 kilograms. With a 3/8 inch or 10 millimeter lift under the heel of the foot, or with the foot placed in the desired shoe, use a plumb bob or laser to confirm that the weight line falls through the anterior aspect of the pylon. To complete the static alignment, stand the patient in the set of parallel bars. The patient should be able to stand comfortably without any sensation of the knee wanting to flex or hyperextend. If the knee is flexing, slide the foot anteriorly. If the knee is hyperextending, slide the foot posteriorly. Note that the angular adjustment of the pyramid will only adjust the plantar and dorsiflexion dispersion of the 12 degrees of movement. Plantar flexing will decrease the dorsiflexion range of motion, while dorsiflexing will increase the plantar flexion range of motion. Ensure that the range of dorsiflexion and plantar flexion motion is maintained during static alignment. Check when flexion is properly accommodated that we have 2 degrees of dorsiflexion and 10 degrees of plantar flexion. For a visual flowchart on how to make adjustments, refer to the instructions for use manual. Once a stable static alignment is achieved, begin walking the patient in the parallel bars. Careful adjustment of the hydraulic valves will ensure optimum comfort and energy. Start by setting the heel stiffness first. Optimize the heel strike to mid-stance motion before proceeding on to the adjustment of the dorsiflexion valves. Adjust plantar flexion resistance to dampen heel strike. If foot slap is noticed or heel strike is too abrupt, increase the plantar flexion resistance. If the heel is too firm or the knee is buckling at heel strike, then decrease plantar flexion resistance. Dorsiflexion resistance is adjusted to control the advancement of the amputee over the foot. If the patient feels they are walking downhill, then increase dorsiflexion resistance. If the effort to advance over the foot is too great, then decrease dorsiflexion resistance. Due to the posterior placement of the pivot point, adjustments of the plantar flexion and dorsiflexion resistances are best done on a gradual slope as a final step in dynamic alignment. Also, changes to the resistance settings will be most noticeable to the patient when they are walking on slopes. After dynamic alignment, torque the pyramid adjustment screws to the manufacturer's specifications. Secure pyramid adjustment screws with a thread locking adhesive such as Loctite 242. If the patient reports the foot is too stiff or soft, as a first step, weigh him or her to confirm current body weight. Assess the true impact level, low or moderate, and review the kinterra specific category selection chart to ensure that proper foot stiffness has been selected. If the heel appears to be too soft, or you observe heel crushing, apply the provided urethane heel stiffening wedges to the distal aspect of the keel. Placement closer to the position of where the keel and heel meet will increase stiffness more than a wedge placed posteriorly. First, apply the wedge using a double-sided VHB tape. Test heel stiffness with the patient and adjust the placement if needed, before permanently bonding it with an adhesive such as cyanoacrylate or superglue. Please refer to the Kinterra instructions for use manual for additional fitting tips and troubleshooting suggestions. If the proposed solutions do not result in a satisfactory outcome, please contact Freedom Innovations Technical Services for further support.